Good evening. My name is John Day, and this is going to be my intramuscular video. The first thing I'm going to show you are the three common areas to give an intramuscular injection, as demonstrated on this towel. The first being the deltoid. To find the deltoid, go to the patient's acromion process and place 2 fingers underneath. The triangular area below my fingers is a deltoid and where you can give the injection. Next, the vastus lateralis. To find this, go to the patient's leg and find their trochanter. Place a palm below the trochanter and place the other palm just above the knee. The area in between the palms is where you can give the injection. Lastly, for the ventral gluteal, once again, you need to go to the patient's leg, but this time is going to be opposite. So if you're using the patient's left leg, you're going to use your right hand. Once again, find the patient's trochanter, but now place your palm on top of it. Your thumb is going to be pointed towards their groin, and your index is going to be on their anterior superior iliac crest. Move your middle finger and the other fingers towards the patient's buttocks. The area in between my index and my middle finger is where you'd give the vaccine. Now that I've shown 3 common areas to give an intramuscular injection, I'm going to go into the Pyxis and pull up Annis Mar so I can give the proper medication. But first, I'm going to hand sanitize. Looking at Annis Mar, I can see her name, date of birth, and her allergies. Now, I'm going to peruse the entirety of the Mar until I find the medication that I'm looking for. And here it is, influenza vaccine. At this point, I would compare the information that I see on the Mar to the physician's orders to make sure that they're correct. And since they're the same, I can go ahead and pull the medication and do my first set of 6 writes between the Mar and the medication label. This is Anna's chart. This says influenza, which it says here. This needs to be given in a vaccine, and this is possible because this is a vial. 1/2 milliliter of fluid is needed, and 1/2 milliliter of fluid is what's going to be given because there's only 1/2 milliliter of fluid inside of the vial, so no calculation necessary. Lastly, it needs to be given once to prevent the flu, and this is flu season. Additionally, the documentation is correct because it has been signed off by the doctor, as stated here. Now I've completed my first set of 6 writes. I'm going to inspect the vial to make sure it hasn't been tampered with, nor is it expired. It wasn't, and it isn't. When it comes to a flu shot, the most common reason to give a flu shot is to prevent the actual flu. Some major contraindications or precautions I need to be aware of are pregnant women, people with chronic pulmonary issues such as asthma, and people with egg allergies, because some of the materials in the flu vaccine are egg byproducts. I will know that the flu shot is working because their WBC count, or white blood cell count, will decrease, and so will the fever. Additionally, they may have some slight mucus production. However, adverse reactions to the flu shot include anaphylactic shock from the egg and also possible neurologic toxicity. As stated earlier, no calculation is needed because there is only half a milliliter of fluid in this vial, and the doctor wants half a milliliter of fluid to be given to Anna. Now I'm going to pick out the materials I need to create the actual injection. When it comes to intramuscular injections, there are several options that I need to consider depending on the site of the shot. In this case, it's a flu shot, so it's going to be in Anna's deltoid. For this reason, I have to use a 1-inch needle. In the other two sites, it can be anywhere from 1 to 3 inches. Additionally, the amount of fluid that can be given in the deltoid is only 1 milliliter max. For the other two sites, it can be up to 3 milliliters of fluid. However, when it comes to the gauge of the needles, all three can take 21 to 25 gauge needles. In this case, I have chosen a 3 milliliter syringe with a 22 gauge 1-inch needle. This is sufficient for the deltoid site, given the parameters I just stated. I will also need an alcohol pad. Now that I have my materials, I can go ahead and do my second set of 6 rights. This is still Anna. Influenza, which it says here. Vaccine, and this is possible because this is in a vial. No math is necessary, so I will be able to give the half a milliliter. And lastly, once. And this is flu season, so that is appropriate. And as for documentation, it is proper because the doctor has signed off right here. Now, I'm going to actually construct the vaccine. If this were a multi-dose vial, I would have to put my name, my initials rather, the date and the time of which I opened it, if I was opening it for the very first time. But this is a single dose vial, so that will not be necessary. I'm verbalizing that I have rubbed the rubber stopper for the full 30 seconds necessary and have allowed it to air dry. There's only half a milliliter of fluid in this vial, so I will not be able to pull back in case of air bubbles. So I will simply have to flick them out. The plunger is at the half a milliliter level. And now I'm going to depress the air into the air in the vial. The syringe is at eye level. There is a bubble present, so I'm knocking it out. Now that I have my syringe, I'm going to label it, being careful not to cover the actual numbers. This label is going to have Anna's name, the name of the drug, the amount, my initials, the date, and the time. The other materials that I'm going to need for this injection are another alcohol pad, gloves, gauze, and a bandage, which is optional. Now that I have all my materials before me, I can go ahead and enter Anna's room. Can I come in? Good afternoon, Anna. My name is John Day, and I'm going to be your nurse for the next 12 hours. Can I get your name and your date of birth, please? Yes, I do see that here. And yes, that is here on your chart. Do you have any allergies, Anna? And what happens when you come into contact with penicillin? Yes, I do see that here on your armband. And it is also here on your chart as well. The reason why I'm in here, Anna, is because I need to give you your flu vaccine. Before we get started, is there anything that you need? Okay. Well, I see that the bed is locked and in the lowest position. The bed rails are up, and the call bell and phone are within reach. So I'm going to draw the curtains, and we're going to get started. All right? Now, before I actually give you this injection, Anna, I need to know, do you have any egg allergies that I need to be aware of? Okay. Do you have any chronic pulmonary issues? Okay. The reason why I ask, Anna, is because the flu vaccine is heavily contraindicated or precautioned against people with chronic pulmonary issues like asthma or people with egg allergies because they could experience a severe anaphylactic shock if they use it. However, I'll know that it's working because your fever is going to go down and your white blood cell count is also going to go down. But you may create a little bit of mucus. Does that make sense? Okay. I thank you for understanding. So, before I actually give you this medication, I need to go through a checklist called the 6 Rights to make sure that this is the right medication to give you and you are the right patient. Okay? Thank you. Once again, Anna Pawlowski. Yes, I see that here as well. Thank you. Influenza vaccine, which it says here on the label. And the fact that it's a vaccine is why you're being given an injection. 0.5 milliliter of fluid. And you see the plunger is at the 0.5 milliliter mark. The tip of the plunger, mind you. And it says once. And this is flu vaccine season for the flu, so this is appropriate. And this has been signed off by Dr. Smukta. So we're okay. Okay? All right. So Anna, at this point, because this is a deltoid injection, I have to ask you to either put your arm over the bed rail or just let it hang, but I need to have your entire arm exposed, okay? If this were the ventral gluteal site, then I would have to ask Anna to lay on her side and have her trochanter and her knee slightly bent. And if this was a vastus lateralis injection, I would ask her to be either sitting upright or to just be supine in bed. Unfortunately, the patients are unable to choose the site because it depends once again on the amount of fluid going to the area, as well as other factors like the size and the gauge of the needle. Okay, Anna, are you ready? Okay. I'm now scanning your armband. And I'm scanning the medication. Here is her acromion process. My 2 fingers. The deltoid. I'm verbalizing that I have allowed this area to completely air dry before continuing. Because this is an intramuscular injection, it has to be given at 90 degrees. One, 2, 3, 4, 5, 6, 7. At this point, I would take this empty needle and syringe and put it in the sharps container located inside of Anna's room. That's it, Anna. We're done. I'm going to take these materials and throw them away. Would you like a Band-Aid, Anna? Okay, it's your choice. Is there anything else you need before I go? Okay, well, I didn't move your call bell nor your phone, so they're still within your reach. I didn't raise your bed, so it's still in the lowest position and the brake is still on. Additionally, I didn't have to move the bed rail either because I asked you to put it over the bed rail. So, I'm going to take these materials and throw them away. This is already in the sharps container. And I'm also going to document that I gave you the medication at this time, that I gave you patient education so you knew why you were taking the medication, and also the assessment of asking you if you had pulmonary issues or an egg allergy. Is there anything else you need before I go? Okay, well, if you need anything, just press the call bell. Otherwise, I'll be back within an hour. Now, I'm going to open the curtains per your preference. Throw away my gloves. And I'll see you in an hour, Anna. This concludes my intramuscular video.